Hello, my name is Dr. Stock. I am the creator of Myofascial Releaser, and this video is a basic training for massage therapists on instrument-assisted fascial mobilization. If you're pretty good with your anatomy, this should be a piece of cake, but if you're not, you will get one of these anatomy guides with your tool, and it will review all of the anatomy you need to know, all of the anatomical areas that benefit most from instrument-assisted fascial mobilization and areas to avoid. So you'll be fine. So once you've brushed up on your anatomy, the next step is to ask yourself if the patient is acute or chronic. And most of you massage therapists won't be dealing with acute injuries, but if for any reason a patient comes to you and they're acute, they just sprained their ankle the day before, or some acute injury that's recent, then you're not going to be performing IAFM right away. Most of you massage therapists will be working with patients who are more chronic in nature, who have been dealing with an injury over time, or are dealing with like restrictions and mobility issues. They're just kind of tight and they need loosening up. That's what fascial mobilization is best for. Now, a lot of you might be wondering, well, why don't you just use your hands for fascial mobilization? Well, your hands and your thumbs play a very important role in fascial mobilization, and you can do a lot with pin and stretch or active release technique, that kind of thing. But what we're doing here is using the specifically beveled edge on the stainless steel instrument to mobilize the superficial fascia, which plays a very important role in the recovery and mobility of a patient. Foam rollers are great. Using your hands is great for loosening up fascia that is deeper. What we're focusing on here is the superficial fascia and using the bevel to loosen up that fascia. It's something that our hands cannot do the same way. So it's pretty simple. Once you've found the restrictions or the adhesions in your patient, you're going to, so let's imagine that we're working here on the forearm. These muscles originate here on the medial epicondyle, and they are the wrist and finger flexors, right? If your patient is dealing with some tightness along here, maybe some carpal tunnel, or golfer's elbow or something, there's probably going to be some restrictions here, and you can use the tool itself to scan and to diagnose. So when you're feeling for adhesion, you'll feel like a grittiness. Now, some level of grittiness is normal, but when you compare it to the unaffected side, you'll notice that there'll be like more grit, and that's basically scar tissue under the skin in that fascial layer. And so first step, you're going to apply some emollient. Our emollient comes with the product. It's solid at room temperature and melts upon contact, and there's a lot of natural ingredients in it. So you're going to be applying some emollient, and you're always going to stroke distal to proximal, and you're going to always hold the tool at 45 degrees. So so if this is 90, this is 45. Distal to proximal, and you're going to perform 20 to 30 strokes per 3-inch area. So I'm going to start with this 3-inch area here. I'm going to go distal to proximal. I'm going to do about 20 to 30 strokes, and you're going to go at about 180 strokes per minute, or about 3 per second. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 25. So I did 25. You see how it's nice and pink? That's pretty good. So now I'm going to move to the distal area here. And again, I'm going to go distal to proximal, 45 degrees, 3 strokes per second. And I'm applying about 4 pounds per square inch. I mean, that's pretty hard to tell, but once you get the hang of it, you'll know how hard you put it. This is too light, this is too heavy, this is too hard. So you're going to go right in the middle, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 4, 25. nice and red. You don't want to go so hard or so long that it starts to bruise. You know, some techniques out there do require that you develop the petechiae or the bruising. This is not that. This is not Graston technique. This is not Washa. This is its own thing. Instrument assisted fascial mobilization. And so you would perform this about twice a week. You know, you can do this like 2 to 3 times a week if the patient is pretty much better and they're just trying to prevent a reoccurrence. Then you can do this for preventative measures. You can do this once a week. So in this area, in the forearm area, there are some areas to be careful around. There's the cubital fossa with some nerves in here, the median nerve and the veins here. And then there's also the ulnar nerve that runs between the medial epicondyle and the olecranon. So you'd want to stay away from the ulnar nerve, that funny bone area, the cubital fossa, and all of that is explained in our anatomy guide. So you don't have to worry about, you know, missing some of the anatomical areas that you need to be careful around or anything. So that's basically instrument assisted fascial mobilization. We have different tools for different preferences. This is an all-in-one tool. We got the scanner edge. This is a large concave edge. It works really well on IT band traps. This is the scanner edge. Works real well for like smaller areas, scalenes, even forearm. If you find like a really adhesed area, you can get in there a little more specifically. And we got this smaller concave edge. It's good for like thenar and around the intrinsic foot muscles. And we got this medium convex edge, and that you can also use for other semi-specific areas. And we got the accusphere. The accusphere is great for getting in between tendons. I like to use that for areas between the semi-tendinosus and the semi-membranosus in the hamstrings, between the IT band and the hamstrings. You can kind of floss also between tendons in anterior forearm here near the carpal tunnel. So that's the gist of instrument assisted fascial mobilization. You can learn more at myofascialreleaser.com, and you can also find our products on Amazon. Just type in myofascial releaser. If you have any questions, let us know, and thanks a lot for watching.